So we are going live. So hello everyone, welcome back. So let me present you the next speaker. So we have Richard Sonnenblick. He's the CEO of Enrich, and he will be speaking about best practices in portfolio management. So with that, I think we are all here focusing on PPM and transformation, and in a pharma context. So I'm glad to give the floor to Richard.
Thank you so much, Mithun. I really appreciate it, and I appreciate the way you pronounce my last name as well. Excellent. I don't get such good treatment outside Europe usually. So thank you, everyone. Looking forward to the conversation at the end. Please put your questions in the chat as we go. We'll have some time at the end for questions. I wanted to start by just talking briefly about what portfolio management entails, because it's a big ask, and we just talked about being change agents. I think this talk is a good follow on from that, because there's a lot of change involved just in implementing a portfolio management process. So in the context of, in the context of that portfolio management process, let me reshare my screen here quickly. Great. We're going to start with data collection. First on the commercial side, looking at revenue, looking at unit sales, cost of goods sold. Then on the R&D side, looking at timelines, looking at costs and FTEs, and looking at risk. And then in those two blue boxes, you're going to have validation beginning, making sure that these estimates, these forecasts hold together, and then a consolidated step of validation as well, making sure the business cases as a whole hold together. This is leading to the meat and potatoes of portfolio management, where you do your prioritization after 4 short months of lead-in, if you're lucky. And then if you're even more fortunate, you're then leading to confident decisions, looking at your allocations, your buy-ups and your buy-downs, your new assets coming into the portfolio, or potentially new partnerships or acquisitions. So there's a lot going on here, but there's even more going on if you use an evergreen process. So rather than doing this once a year, you might be looking at the updating of your valuations for assets and franchises and therapeutic areas. You're updating what's on deck, what you could fund if you have additional resources, or what you could buy up for more accelerated development, and what reallocations might occur. And then this circuit can complete as many times as needed based on events. Those events may be internal. Has there been a clinical readout or some other change in development status? Has there been something external, like a change in payer posture, regulatory posture, or the competitive landscape? Or are we bringing something new in, either promoting from discovery or moving something in a partnership or even an acquisition frame into our portfolio process and our pipeline? So portfolio management involves a lot of effort and time and attention. And if your organization isn't doing this with an eye towards the maximum value of portfolio management and maximum impact, you're likely, and maybe even if you are, likely to hear complaints, right? So I did not lift these from any of your executives. Any likeness is purely coincidental. We already know what we should work on. The valuations, forget it. They're never correct. We're too busy executing. So I think there's truth in all of these, some more than others, but it's important to understand why these are surfacing and how to work against or counter them. And that's what I want to talk about today. Is portfolio management really worth it? And how do you quell these naysayers? And I'm guessing you're at this conference, so you probably yourself have a good sense of why portfolio management's valuable. I wanted to give you a little more ammunition in this way. And I wanted to help you as well think about, are you making the most of your portfolio management process and your tools? Because Enrich is a tools company. So have you ever watched two executives argue fruitlessly about an NPV? Such a discussion, it's unlikely to go anywhere productive. And they're going to say the valuations, well, they're never correct. And they're probably right. And that's okay, because that's missing the point. You can think about that valuation and that metric, like net present value, risk-adjusted net present value, as a cover of a book. It's not replacing what's inside. It's an indicator of what's inside. Those valuations are helping you separate those projects that are clear winners from clear challengers, and those in the middle that probably require further additional vigorous discussion. That valuation is going to do more than just create those covers, right? The valuation's providing a framework for discussion. So arguing about the NPV itself may not be fruitful, but it's valuable to argue about the drivers of NPV. That's really where portfolio management at the valuation stage provides a lot of value to the organization. So let's take a look here within a frame of the Enrich Analytics platform at precisely some of this value. So we can look at a pipeline view like this, and we can drill down into one of the assets, and sure, we'll get those key performance indicators. When are we launching? What's the PTRS? What's the risk? What's the cost to launch? If you think about profit and loss statements because you have a finance background or an MBA, it's good to look at that P&L or the balance sheet and understand more. And it's good to be able to move from asset to asset and look at this information. But it might be even more valuable to look at some of the drivers of all of those things. In this case, we're talking about a target product profile. And the TPP here is in the third column on the right. But we're also comparing it to the emerging and current standard of care, right? So we can look at our price points, we can look at our side effects, our mortality, our convenience, our efficacy, our ease of administration, whatever's appropriate, because it represents a driver of market share or market size or pricing. Let's put it easy to surface in the portfolio management tools that we use. Let's go one level further down, and let's actually look at a 6 or a 7 stage market model for one of these assets. So now we're going to be opening a page where we can view the population by region, the prevalence, the diagnosis, the treatment, the units per patient, units per treatment, compliance, and so forth. And all of this is going to be leading us to a regional patient flow and then a sales by region. So this is where the conversations really have legs and have value. All right, let's jump back here. I remember in one company we worked with, all members of the product team were asked to complete both a risk assessment and a commercial assessment for the asset they'd been working on together for months, in some cases for years. What was interesting is when they came together and brought those assessments and compared them, they saw that there were latent disagreements across the commercial space, across the clinical risks and so forth. And yet they've been working together for years. And if those latent disagreements don't have a process where they get surfaced, you're going to miss out on understanding that those agreements exist in the first place. And even more importantly, you're going to miss out on dealing with the meat and potatoes of those disagreements, whether it's about the risk or the efficacy or some aspect of the translational model that's in play. So valuation also aligns the entire team around the reason for an investment. So there was another company we worked with where the clinic was where all ideas, good, bad, and otherwise, went to die. And it's not because of the additional attrition in the clinic. It was because there was no unified view of each asset as it moved from discovery into the clinic. So that translational piece was the least of their problems. The clinic was getting each asset and treating it like they had never seen it before. They had no idea about the value. They had no idea about the market, the payer situation, and so forth. And so every asset was recrystallized by the clinic, and it was immensely demoralizing for the discovery team. So if there's a process, and portfolio management should be a key part of this, where everyone can align around the reason for these investments, that's a huge value add that has absolutely nothing to do with the endpoint NPV. The final point I'll make here is that valuation sets a baseline for value and risk. So we know that value, risk, and cost all kind of change over time as an opportunity goes through an 8 to 12-year life cycle in drug development. But sometimes we have a bad memory for where it's been. And so setting that baseline in the tool, not just about milestones, which is where from a PMO standpoint we think about baselines, but setting it for the TPP, setting it for the market size, the market share, and then having that to refer to later helps learning occur. All right, so next one. We already know what we should work on. This is like the frog that's in the boiling or almost boiling pot of water and doesn't jump out as it gets hotter and hotter and hotter. We sometimes are so heads down that we don't think about whether our priorities have changed or should change. Sometimes the projects that seem of obvious value initially are shifting or should be shifting in priority due to internal or outside events. So we just talked about having a solid baseline. Now we're talking about the need to have the changes to that baseline readily available to us so that we understand exactly how the competitive landscape is changing, how our clinical readouts are changing, what we think about this drug in light of competition, and whether we see other critical changes in our portfolio. So let's jump back now, and let's go back to that portfolio view we were looking at a moment ago. So what I'm going to do here is actually create a view or set of views with that baseline. We're going to say we want to look at the same portfolio about a year ago, as of 2020. We're going to reload this so that that historical data comes into the data set as well. And now we're going to go back to a series of views in storyboard mode. So this kind of a waterfall view is a great place to start with what's changed since the last portfolio review. The y-axis is risk-adjusted net present value, and we can see the value of the portfolio a year ago over on the left side of the screen, and the value today on the right side of the screen. In the middle, we're looking at where have the reductions been by asset and where have the increases in value been by asset. And if there are adds or drops to the portfolio as a whole, that information is shown here as well. So this is one useful place to start because it helps us focus the conversation on really what's changed or what hasn't changed. We can drill down one level and begin to ask, what are the big movers from a scatter plot point of view? And we can see, well, eaglogen started with a big ENPV, and now, judging by this tail, it's grown even more since that last portfolio review. We can see 3 other projects very quickly that have grown in value, and one that has increased in probability of success as well since that last portfolio review. Now we'll drill down one level further. We can see that there's been that change in ENPV that was illustrated with the tail of that bubble. We can also see the changes in cost and revenue since that last portfolio review. If we like to read P&Ls, we can see a heat map on the P&L that shows us those changes. And perhaps most importantly, again, we can go back down to that TPP, and we can see that we've had side effects that have been discovered in the last year. And as a result, we've changed that price of our asset or our drug from $100 a week to a price point of $50 a week, which sounds reasonable, except for the emerging standard of care has shown a change as well from $10 a week to $5. So is there something in our label that makes it obvious that we can command a 10-fold price premium in this case? If not, we need to have a substantive conversation about this. Similarly, we might want to be looking at changes in launch date. And so here you can see this second to last column on the right shows us our launch date variance in days. And so we can see a few of these projects have actually moved up considerably, 2 or 3 or more years in launch date, but we have a couple that have slowed. So let's look at Madison here. We can come down into the summary view and see that change of about a year. We can even look at this in a Gantt chart view where we can see what's happened is NDA hasn't changed, but phase 3 has increased by about a year's time here. And that's impacting this. Now, because it's a single source of truth, we can bring up the audit trail of who's made changes to this asset, who's specifically made changes to that set of milestone dates, and we can talk to them about the reasons for that. Okay, last but not least. So we're too busy executing. Execution requires the orchestration of thousands of details, so it's easy to understand why you would want to keep heads down and not think about anything but getting your drug to the finish line, getting it to the market, getting the payers aligned, and getting it actually into the hands of patients who need it. The problem is that if you're executing on the wrong ideas, or you're not executing on them in a way that's going to meet your strategic goals, you're going to find that no matter how good your execution is, you're going to miss your opportunity to sustain the company and to grow the company. So what I wanted to do now is bring up a case study where we were working with a company who was fortunate enough to have just landed a blockbuster in the market, and the commercial success was proving it truly to be a blockbuster. So then they looked up and realized this base business was no longer going to give them the growth they needed on its own that the street was now looking for from this publicly traded company. So that was okay. They did a little analysis with us and they said, well, we've got some key follow-ons, indications that we know we can leverage with this platform. The problem is we put those key follow-ons into their business plan and it didn't get them anywhere near their revenue target on a 6-7 year basis. You could see they're falling well short in that upper chart of that green revenue target line. So then we had to sharpen our pencils a bit with them and add in a set of biologics that represented a partnership and probably a potential acquisition. Got them closer, but it didn't get them quite there. We had to take one step further and aggressively move some biologics from discovery into the development pipeline before we could see the amount of growth that we thought the market was going to require from them. Then we took this one step further and went to a Monte Carlo simulation. So we'll look specifically at this one portfolio with everything built in, and we'll look on a cumulative distribution. So we can see here that in order to get to that $10 billion net present value, there was only a 30% chance they were going to do it, even with everything thrown in here. And the fact was that throwing everything in this way was dramatically more than they were willing to pay for, or the board had said they were willing to pay for. And so you can see, for example, here in the bottom chart, their $300 million annual budget was roughly doubled in 2022, and then similarly in 2023, in order to get all of this to market. And even so, only a 30% chance of getting there. So this is helping you move to the conversations that make sure your shots on goal are the ones you need. All right. I wanted to talk a little bit about one-person portfolio management because we see it in a lot of companies who initially come to us and say, hey, we want to do portfolio management. I'm the person, I've been tasked with portfolio management. Now I need software. And one-person portfolio management is a starting point, but hopefully it's a starting point of a long journey. The goal is to share responsibilities for portfolio management amongst a broader and broader coalition. And that's going to ensure portfolio management has staying power and true value for the organization. You can think about portfolio management circling out in broader and broader spheres of influence within the organization and spheres of involvement within the organization. That first review cycle where you start doing portfolio management, the portfolio team has a lot on their shoulders. They're sprinting to gather all this information. Many times, a lot of the assets don't even have valuations, or the valuations are incomplete or outdated. The units don't match. It doesn't hold together. You can't aggregate it. A lot of long nights ensue, and you can only hope that by your second portfolio review cycle, a lot of that data has improved in integrity and completeness, and the project teams are giving you higher quality information to synthesize, and the aggregation might not be quite so painful, especially if you're putting a tool in place. You can't stop there, though. You might have a chance to sit down and rest if you can involve the project leads and the project teams to actually upload data into your single source of truth themselves. But you're still going to have to do the vetting at this stage in the review cycle maturity model. Now you can lie back a little bit further if in the next review cycle you can begin to get some of the vetting and validation of those business cases in the hands of those who are truly accountable. The franchise leads, the therapeutic area heads, ultimately they should be accountable for the business cases that fall under their purview. If you can do that, and they can work within the tools to validate those business cases, you need to build the portfolio views and think about portfolio selection and balance and scenario analysis. But there's a lot that now you're outsourcing to the teams. The fifth cycle here, if you can get the teams to provide buy up and buy down and optimistic and pessimistic scenarios, now you're adding incredible value to what the portfolio frame allows your executives to do. To not just say thumbs up or thumbs down on an idea, but what if everything goes well? What if everything goes poorly? What if we want to double down on some of these initiatives? What would that do to the value of those initiatives with a 6-month earlier launch or a year later launch, so that we could fund some of our critical initiatives more healthfully? So if you don't move up the hierarchy and you stay for years and years at review cycle 1 and review cycle 2, you're going to burn out your portfolio team. And even worse, portfolio management is not something that's going to be embraced by the decision makers. Portfolio management needs to be something that the decision makers see as not just the product of the portfolio team, it's the product of the project teams, the asset teams, the commercial teams are involved, business development teams are involved, and the therapeutic area or franchise heads have bought into it and feel accountable. Only then will the executives feel that the information is of high enough quality so that they can move forward with an analysis and making decisions based on what they see in the formal process. So very quickly, just in summary, if you don't keep the end objectives in mind for portfolio management, you're going to miss out on some of the critical value if you think it's just about valuation or just about getting a bubble chart built. And the fact that there are so many moving parts around portfolio management, those events and activities of the evergreen process, a single source of truth, but a transparent one, is essential. And remember that NPV is just a number, but make sure your single source of truth is wired to provide you the assumptions that lead to that, that valuation estimate. And realize that being right or getting a perfect valuation is not an end in itself. We're really looking to leverage expertise and the collective wisdom of the company in these decisions. And we can only do that over time if we're able to see how things change over time, and we can learn from our mistakes in valuation, learn from our mistakes around misreading the commercial opportunity, misreading the efficacy, and so forth. And finally, think about your strategic goals. Portfolio management is going to help you understand not just the value of an opportunity, but the ultimate value of your portfolio and your ability to meet some of those strategic goals over time. So if you haven't heard of Enrich before, we work with companies all over the globe, and they love us for that transparent single source of truth, and they use our cloud-based portfolio management and project valuation platform for integrated market and financial analysis, for scenario analysis and prioritization, But you've seen a few of the boardroom ready visualizations here. And I haven't shown you how our exports are editable in PowerPoint. You can actually move forward with your analysis in real time using our tools, or you can build some PowerPoint decks very quickly and bring those to your meetings and know that the data is up to date. All right. Love to take some questions here. Oh, and sorry, one other thing. Our implementation times are also a big fan favorite. From 2 hours to 3 weeks, we give you the ability to start using the tool in portfolio management configured for your specific needs. All right. I have one question here. Thinking about selling portfolio management to senior decision makers, what examples would you cite as examples of what happens when you don't? Portfolio management and the need for portfolio management is something that you always see in hindsight, but you seldom see with foresight. And so you realize that you should have had portfolio management in place when you suddenly realize that you don't know what your teams are working on. You don't know the individual assets, and you don't understand the value of those assets. And you may have, as we talked about earlier, those zombie projects that refuse to be killed. You may have redundant projects in your portfolio where you're going after the same target, not even knowing it because people aren't speaking. You got to surface all that through the portfolio management process. Portfolio view you showed was the current state, able to use tool to protect out a snapshot of future portfolio. Yes. Yeah, so we're looking not only at where the portfolio is today, but where it might be in terms of asset composition by phase, asset composition by spend, and value by therapeutic area or by franchise over time as you go. So it's a forecasting tool, and it uses Monte Carlo simulation as well to perform those forecasts when needed. Great. Nathan, do we have any other questions or?
Yeah, I'm just checking. So there's one question from Li. In the portfolio view, you showed around 15 minutes ago. Was that current state? Are you able to use the tool to predict out a snapshot of a future portfolio, either through probabilistic modeling or optimization on various criteria?
Mm-hmm. Mm-hmm. Right. So yeah, you might look at the portfolio to be a little bit more specific on that answer. You might look at the portfolio on a pipeline progression basis, where you're looking at assets matriculate or attrit out of the portfolio over time, and you can see as those assets go to gray, those assets are going into the market. And if you do this on a risk-adjusted basis, now you're looking at how many assets are in your portfolio over time, assuming some of these attrit out not to the market, but are abandoned, right? Similarly, you can begin to look at scenario comparison views that might have 3 different investment plans for the portfolio and looking at how those play out versus your revenue goals and versus your cost or your budget constraints over time. And then, yes, in terms of optimization, sure, the ability to build an optimization and then to run that and get a solution to your optimization where now you have that optimization result as well as part of your portfolio that's meeting a set of constraints. It's something we do as well. It's your 20-second tour. All right. Well, thank you, everyone. I really appreciate the opportunity to chat. Sorry, Mithun.
Yeah, no, sorry. You're perfectly on time. Thank you very much for this wonderful, wonderful presentation, Richard. Really like the idea that NPV is just a number and you should not read the book by the cover. Really, really profound idea. And I know how much a lot of my clients suffer with those arguments like, life is short, take the decision, and actually those hasty decisions made on just some figures and there's no coming back. So beautiful. I would love the opportunity to continue the discussion during this conference sometime, so that we can talk more about this, about Enrich. And with that, I would like to thank you, and we'll go quickly backstage, and I'll be back with the next speaker. So thank you, Richard, and everyone, please stay tuned.
Thank you.